Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everybody. So this is Donna Corriel, and I am recording yet another episode of Entrepreneurs in Healthcare. And with me today, across from me digitally, is Dr. Karen Barnard. I'm going to have Dr. Barnard tell us all about herself before I ask you, Dr. Barnard, the question of the hour. So welcome.
Thank you, Dana, and thank you for inviting me. I'm really excited to have this conversation with you.
Me as well. Now, tell us a little bit more about you.
I am originally from South Africa, where I completed medical school. And then pretty soon after that, I moved to the United States. So I've been in the United States for 31 years. And I did residency in internal medicine, and then I did two fellowships. Actually, I did general internal medicine with a focus on research, and then I later went into endocrinology. My entire medical career was in academics as a clinician educator and absolutely loved it. And then a few years ago, I made a transition of my own into entrepreneurship. I started my own career coaching business exclusively for physicians. And, Dana, I really believe that physicians deserve to be in careers, jobs, or businesses where they can thrive and continue to do meaningful work. And my passion is to help them create that.
Okay, wonderful. I do have a question on that, but before we go into that, I do like to open up this show with the question of the hour, what I call it, and that's entrepreneurship in healthcare. Is it good or bad?
Oh, it is good. I come fairly and squarely under the good. And I can give you my reasons for that if you want, or we can move on.
Yeah, we absolutely want to hear the reasons.
Yeah. So whether it's something you're doing on the side or whether it's something you decide to do full time, entrepreneurship, I think physicians are made for it, even though there's this thought that, oh, doctors aren't good business people. I think that is nonsense. When we really do something we love, whether it's on the side or even full-time entrepreneurs within have our own practices, direct primary care, concierge care, or we're on the side doing expert witness or we're doing consulting, we can really bring renewed energy and vigor and growth into our lives, not to mention some of the financial benefits of either having a side gig or going into entrepreneurship. I think entrepreneurship is an incredible growth tool for physicians. And I also know, this is my belief, I believe that many of our healthcare problems will be resolved, healthcare system problems will be resolved, the more physicians take ownership and start their own practices and their own shops doing medicine on their own terms, giving them autonomy and freedom and flexibility and all of those things that are so important to living the lives we want. So that's why I think entrepreneurship is absolutely wonderful for physicians.
What a timely comment, because tomorrow, and I realize that people may be watching or listening to this later, but tomorrow we are going live with our Private Practice 101 virtual conference. And so that
Yay.
is, yeah, that's a way for doctors to come, and it's free while it's live. Although when you hear this later, if you want, you can certainly purchase a ticket to access it. But it's certainly a place where you can kind of gather online for both the interaction of a conference and for the actual lectures. We have an incredible expert lineup, speaker lineup that's ready for people to soak up. So I'm so excited about that. How do you feel? In what way do you feel that doctors that go into private practice can really solve some of the problems in healthcare? I mean, I know my answers, but I'm always curious what others have to say as well.
From my perspective of the work that I do, so many physicians come to me burnt out, fatigued. And it's not because they can't work hard. Physicians can work hard till the cows come home. That's not the issue. The issue is they're working in an environment that's draining them. And most often it's a values clash. Those things that we went into medicine for, like the amount of time you have with the patient, the ability to set up your own schedule, the ability to perhaps have a situation where you have the flexibility where you can step away for a week and things don't go bust. Where you can decide how you want to run your show so that it is in line with with what you feel healing is really all about. And so, I think that I would say that for me, the main reason entrepreneurship and private practice is a viable way out is because it gives the physicians their power and autonomy back. It's not easy. Yeah, it's a whole different skill set you have to learn. I'm not saying, it's all roses, but the growth and if our physicians are happy and healthy and fulfilled, they will show up in the present with patients, be better healers, and then the patients will benefit from it. So I would say that's my main answer to that question.
Yeah, I personally definitely agree. I think that there's a difference between when you're in charge at your place of employment and sort of making the rules versus when you aren't. And that's not to say that every human needs to always be in charge. But in this particular instance, we're talking about a healthcare relationship between the patient and the physician. And what happens is that when you're not in charge as the physician, those entities that are in charge are often so far removed from that interaction that they sort of are making rules and regulations on your relationship that don't fit. And it's the person that's there at ground level that really can make a last minute decision that can make such a great impact on the endpoint person, client, patient. And I think that that's really a value, especially in private practice that you own, or like at least in a smaller setting where there's less middlemen. There's been so many articles that's been written about these middlemen. So when you were practicing academically, were you experiencing some of those breaks and that sort of dysfunction?
I wasn't really. I think for me, what happened was I wanted to do something different. I highly value, again, I focus a lot on values because this was really true for me, that my values shifted, that I wanted to spend more time. My mom had just passed and she lived in South Africa. And as I reflected, I was like, yeah, I save my family as a high value, but where's my time? Where am I really spending my time? I wanted to be free to take a month and go visit now my octogenarian father without feeling like my colleagues have to cover, and do I have the PTO? All of those things. So yes, I could still practice within reasonable way that I wanted to practice. I was at the VA for the last few years of my career, and I know VA, either love or hate it. I really loved it. And so I can't say that I really had those issues, but I do see them for sure in my clients.
Yeah, I mean, I'm sure that you are in touch with a cohort that does represent, folks that deal with so many issues. Obviously, it's sort of a selection bias in that I'm assuming that if they're seeking out coaching, then there's something that they need organized in their life or something that they need guidance on. Would that be a correct assessment?
Yes. So the clients who come to me are either they're feeling really unhappy and they don't quite know why. They don't know if they need a change or not. So they're there to really get some clarity around, is it me or is it the system? Can I make some changes within where I am? Or they come to me, or a various spectrum, but sometimes my clients will come and say, I've already tried to set my boundaries. I've already gone part-time. I've already moved to another practice. I want to do something completely different. Help me figure out what that is and how to get there. So that's really the spectrum of, and then I help either with the clarity ongoing, and I also help with the nuts and bolts of getting you what you need to get the next job or the next career in or outside medicine. It's either way. Just depends on what's the right fit for the physician. And I'll say this is that as physicians, often we're giving and externally driven, and raising families and sometimes even taking care of aging parents and younger kids. And do we really ever sit down and say, well, wait a minute, where am I at? What's important to me? What are my priorities now? Where do I want to be in 5 years? That question most people hate, but really to sit down and say, wait, am I becoming who I want to become? And so that's also the space that I provide, is really helping physicians sit and say, okay, let me reflect. Am I still going where I want to go?
I'm thinking through some of the things that I want to ask you, but before I do, I just want to mention to everyone that the reason Dr. Barnard and I connected is actually because she was selected to be a speaker in the lineup of an upcoming live virtual conference that SoMeDocs is throwing and featuring live. And that's the non-clinical conference coming up in November of 2024. If you're listening to this and it's past November 2024, you could still purchase a ticket for access. And I'm so excited that you've joined the lineup. Can you tell us offhand what you are going to be lecturing about?
Oh, yes. My favorite topic. I'm going to be talking about, beyond medicine, what about coaching? The fulfillment and the joy that a career in coaching, either as a side gig or as a full-time gig, can give physicians. So I'll be covering the different types of coaching, because there are many, anything from health coaching and lifestyle coaching to weight loss coaching, to career coaching, to life coaching. And physicians are in various roles in that. So I'll be showcasing some examples and then really help the audience figure out if coaching might be right for them. So in terms of your strengths and skills and the income you want and the lifestyle you want, might coaching be a good fit for you? And then I also would like to give some strategies as to, how do you get started if you're interested? And then even, some of the challenges and joys of building a coaching business.
This is going to be a great topic. I am thinking through how to word some questions. I want to pose some questions to you that are going to be quasi-difficult questions. I'm sure for you, you'll have no problem answering them, but I want to ask raw and real questions based on some of the comments that I've seen circulating in some of the Facebook groups and some of the feedback and reactions that I see, at least some of the physicians out there have towards the coaching community, I think it's fair to sort of pose them to coaches. The questions vary from, and I'll start with one question. There are claims by some physicians that some coaches are taking advantage of physician vulnerability at a time when we need to really kind of fix the healthcare system and not kind of make money off of colleagues that are struggling. What do you have to say to those claims?
Mm. Yeah, and I first want to say that that's if that's the perception that, and I've heard that before, that is, that's a real shame if that is happening. I've thought about this a lot, in my own business around, am I working on the wrong end? Should I be getting into organizations and working with leaders and trying to change the system to make it better? Or do I work with the physician? And there are people working in the organizations doing that fantastic work. What I find most rewarding is helping a physician see that it's not their fault, that they're not lame or weak, that they can't cut it, that there's a serious issue, and then to help them diagnose and figure out the plan is such a gift to them. And those are not my words. My clients say that I changed their lives. So I think that in any industry, there are those who will be out for a quick buck, like any industry. And I think coaching tends to lend itself to that because it's not regulated. I mean, seriously, anybody can throw out a shingle and say, I'm a coach. There's no training requirements, there are no certification requirements, and charge whatever they want. So yes, that obviously is a setup for people to take advantage of that. But I think as a coach, you need to examine carefully what end are you helping? And it's possible, like the work I do, I don't only help people get out. Sometimes that's what's needed. Sometimes people need to quit just to get their mental health straight. Physicians need to quit. But a lot of the time it's making some tweaks to make it more manageable. So I believe in empowering the physician. And the comparison I like to, or the analogy I like, is to say, if you're in a bad marriage, so do you stay and just suck it up? Or do you say, hello, we have a problem. Let's get some help. Either we need to split or we need to make some changes to make this work. So I'm not sure if you have any follow-up on that, but that's my basic view on that question.
Yes, no, that's great. And actually, a follow-up question to that would be, there's all kinds of things that are said. And so another question would be, if everybody becomes a coach, obviously everybody in quotes, not everyone's going to become a coach. I'm hoping that everyone, stays in medicine and continues in the trajectory of being in the field that we set out to be in the first place. But if everybody becomes a coach, then are we all sort of like coaching each other? That's the other claim that's always put out there.
Yeah, I can see that concern, and I've wondered about that myself. I think the reality is that the bar to getting in is really low. Like I said, anybody can say, I'm going to do some coaching. But to really be effective and help your clients, whoever you're working with, transform and have a successful business, that bar is really high. And so it feels like everybody's becoming coaches. I would wonder how many of those who started out 10 years from now are still coaching exclusively. So yes, it can feel like that. And it also depends on your reasons why, and at what stage of your career you're in. I'm also concerned about physicians bleeding out, and we're bleeding physicians and they're leaving medicine. So there is that. And I do believe that physicians find their way, and those that really love patient care come back to it in some form. I have at least 30% of my clients left, took a break, did something, and have circled back to doing some form of patient care. So I think if we look at the arc of this, I feel much more hopeful than being at one data point in time.
Yeah, that's great. I like that visualization of an arc. Speaking of the certifications, you had mentioned earlier that, the bar is low, that you don't really need certifications. I do know that there are certification programs for coaching. I also know, again, not from a personal perspective, but just from rumblings on social media, that they have a very hefty price tag. So the question is also what do you think about the certification programs that may be charging, and again, this is totally objective, but I'm sorry, it's totally subjective, but that may be charging an arm and a leg for getting certifications? And do they make one a better coach just because they have that certification? We'll be right back. Did you know we have multiple series already available to watch or listen to inside of our series section? Check out the second season of Conversations with Shem, starring as host the legendary author of The House of God himself, Dr. Samuel Shem.
I've watched you unfold too in your writing.
I know it's a terrible burden and you'll get shat on, but we'll have a good time.
Yeah. If we answer that question and the answer is yes, we value money, then we're doing everything just right now.
Oh, because the food is really good, that the hospital's really good.
Healthcare workers have been always stressed, but of course, above and beyond.
At this age.
To learn.
Yes, the disparities still exist.
People in the C-suite, the corporate people, they don't care. To them, doctors are just employees.
And that's what people have really responded to, the authenticity.
All I really wanted was to come to work and feel like I was rowing in the same direction as everybody else.
Like, you could be a doctor, you could be someone who works in a parking lot for the hospital.
It is not uncommon for people to put aside their personal life.
I could never speak like that.
But we are not listening to the why.
How are you working to co-produce solutions?
And he said, all well and good, Dr. Vonnegut, but if the dollars work, nothing else matters.
When I started medical school, I was the only person who looked like me in my medical school class.
Something about the struggles of men and friendship sort of as they age.
And people hate it when I say this, like, you're just scaring me. I can't do anything about this.
And I had my threadbare blue blazer, and they all had these $1,000 suits.
Tearing something down in order to get to what's real and important.
Because we had to march across the bridge, one of the biggest marches ever.
They would only pay me half of what they were paying me now.
But it's true, I tell you or not.
No, you don't have any choice.
I need to promise you that it's not over.
I called my wife and say, I need new clothes.
Good connection is good medicine. That's the one phrase I've come up in my 76th year, I think.
Check it out on doctorsonsocialmedia.com/series. Now back to the show. And do they make one a better coach just because they have that certification?
Yeah, that's a really great point. I can say from my personal experience, while I did a lot of coaching and mentoring with medical students and trainees during my training and as an attending, when I did my coaching training, I feel like I got so much from it. I'm a better listener. I'm I also worked on my own stuff, my own limitations and my own boundaries I was putting on myself. So I felt like for me, and I think many of my colleagues, physician colleagues who have gone through certification feel the same way, that it has, I feel like it's made me a better coach. And it's not one and done. I still do courses and other things to keep me, as one would CME, right? I do it to keep me active, to keep me inspired, and to keep improving, what I'm doing. And yes, the cost is really high. And I think there are so many different programs. I mean, even for this talk, I've been talking, there are a lot, but I think the ones that are most used by physicians do require a significant investment. For me, it was worth it, but I can only speak for myself on this one.
Can you give the listeners a ballpark figure as to how much it does cost to certify?
Yeah, so if you're looking at, many of these courses are virtual, some require some in-person presence as well, but the range is somewhere between, I'd say 14 to 15K to like 25K. And that is everything, training and certification, that's the whole bundle. So yeah.
And does that certification apply only to treating other doctors, or does it also apply to treating patients? And is there even a role to being a coach where it comes to patients?
Yeah, so the certification in coaching is, because it's so unregulated, it's all over the place. So the training is one thing, and then many of the training programs do their training so that they're International Coaching Federations certified. The program is certified. So that means if you, as a trainee, do their training and their certification, then you are eligible to become ICF, International Coaching Federation certified. It has to do with the number of hours in the course and so on. And why that's important is that most businesses, organizations do require, if you're not doing health coaching, some ICF certification for a lower tier or middle tier. They don't care. They just want you to be ICF certified. If you're looking at health coaching, and yes, there is a huge role if you look at health coaching for coaching patients, like lifestyle coaching. Then of course you're doing it as an MD, and MD and coach. And there's a national board of health. It's the national board of, there's a health coaching where you actually take a board exam at the end of it. So that's a little bit of a different path than somebody who wants to do leadership coaching, life coaching, or even the coaching that I do. I'm ICF certified because I have coached in organizations, and that's what they required. But if you do health coaching, there are some other pathways.
Do you think that this could potentially be added into the curriculum of medical students in the future? That is, if coaching is deemed to be an important aspect of connecting with our patients and shaping their health plans, do you feel like this could be inserted into future curriculum?
Yeah, I mean, it is already in certain residency programs. Residents are getting their own coaching and learning some, and doing peer-to-peer coaching, learning some of the coaching skills. And yeah, I can tell you, I took my training while I was still practicing, and I used many of my coaching tools on patients. Some little tools that I learned. So especially when it came to, managing chronic disease and lifestyle issues. So I think the role, the medical school curriculum is already so jam-packed. And I think that the role would be the coaching principles around how do you really listen? How do you help people make behavior changes? How do you deal with change? So there's already some of that, of course, in the curriculum, the whole behavior change models. So some of that's already there.
Okay, wonderful. The reason I always kind of try to think about the future generation of doctors, and especially since we've opened a student section of SoMe I'm always kind of brainstorming through what do the students need that they're not necessarily getting in their curriculum, but may need in the future. How do you go about marketing your coaching services?
I actually, to be 100% honest, I do very little marketing. I'm just fortunate. I have a lot of word of mouth clients and referral clients. So that has really done very well for me. I do a fair amount of content on LinkedIn. I also I make a point, and in coaching, it's sort of like, it's the one-to-one relationship that's important. So my outreach is a lot to physicians that I know, or friends of physicians, or somebody wants to have a conversation, and I get on the phone, and I talk to them about what's going on in their lives. So it has been organic for me. I also get overflow from a mentor coach of mine. So if she's full, she'll often send me clients. So that's how it's worked for me.
Oh, wonderful. And I happen to also agree about LinkedIn. I really like that as a social media platform. And in fact, have just completed a LinkedIn blueprint that's now available on SoMe to any listener and subscriber out there. If you want the blueprint, it's a 5-day kind of step-by-step to improving your profile, especially for newbies, but even for docs that are on there that just want to freshen up their profiles. You can kind of find that on the front page of doctorsonsocialmedia.com. And then we also have a profile building package that's just been added in for anybody that kind of wants the hand holding help of freshening that up. I find LinkedIn really great for connections and just really a good space for networking online. I do think it can be overwhelming. A lot of times you just get a bit spammed through messaging and different things. And so I'm hoping that SoMe can help us to at least niche down a bit of that networking, where our members can really kind of network with like-minded doctors and sort of get to know others, always perfecting that step and taking in feedback, et cetera. All right. So this is really exciting. I am so thankful to you for coming, for talking about entrepreneurship, for being willing and open to field really some tough questions about coaching. I think that you answered them really well. And I'm excited to hear you talk at the non-clinical conference and see what your perspective is. So I'm wishing you luck on your presentation. Before we go, do you have any specific ask?
Thank you. First of all, Dana, thank you. I really enjoyed this conversation. I have a free newsletter, and it's a newsletter in the sense it's full of tips and thoughts and tricks. I'm very, very practical minded. I'm not so much into the woo. So, although I know the woo is important, but I send out a newsletter once a week, every Wednesday. And if anybody's interested or thinking about a change or in a transition phase in their career, you may really find the articles useful. I write them all myself, and then I refer to some other useful resources as well. And you can either sign up on my website for that or my LinkedIn profile. You can access it directly from there.
Wonderful. We'll get you also a profile into SoMeDocs that can be linked into your lecture, and your lecture can appear on your profile, et cetera. And that way, anyone that watches or listens to this can see the show notes and find the profile link there. Thank you so much for joining me. I wish you luck in your endeavors. But again, also looking forward to that November talk, and I'm sure we'll be in touch until then because we're going to be marketing the conference together. So it's going to be fun. So thank you.
Thank you, Dana.
Thanks so much for listening.